Hi, I'm Dr. NainaMD, Fusion of Science and Beauty. I'd like to welcome you, my next guest, Dr. Mark Berman. He's, again, one of the most amazing plastic surgeons I've ever met and amazing at his technique. So I know that I've brought you back on once to talk about facial rejuvenation, and we had an amazing, great conversation. But today, I want the audience to really understand some of the more serious diseases you're treating with stem cells, and just share us your experience. I mean, what kind of chronic diseases are you looking at? And just give me maybe an example or two, if you can share with us, of things that you've done. I know the other day I was in your, we were having an amazing conversation about, remember that you were putting stem cells in intraventricular. And so please share your experiences.
Well, let me just give a little background.
Yeah.
When we started doing fat grafting for facial rejuvenation, we realized there are a lot of stem cells in fat. And most people think all stem cells is embryonic, right?
Right.
But our own bodies are loaded with these cells, and we can isolate them from fat. So with a little mini liposuction procedure, we can get literally millions of stem cells within an hour. Yeah. So what happened was, back in 2010, when I was president of the American Academy of Cosmetic Surgery, I was visiting these doctors in Japan who were taking fat and stem cells, combining them to make bigger breasts.
Right.
And I'm looking at this, I'm going, 5 hours to make bigger breasts. What about helping people who have orthopedic problems, arthritis? What about people with Parkinson's and neurodegenerative conditions and all kinds of things? Today we just treated a guy in my office who has COPD. If you watch those television commercials for Spiriva, they tell you COPD is untreatable. We can reverse COPD. So what we started doing was investigational treatments, if you will, deployments of what we call stromal vascular fraction, which is basically...
Is that the stuff that the stem cells, they have the stem cells in the fat, right? Is that what you call it?
Exactly. So when you get rid of all the grease, the cells that are left over are some red cells, white cells, platelets, growth factors, and a whole bunch of stem cells.
And you've got a process where you can separate all the other, all the kind of like the stuff you don't really need, right? That's a kind of inflammatory. So you can relatively get a nice, clean, of those stem cells and growth factors that you're talking about, right?
We get a pretty good supply of this stuff, and it's all filtered.
And
so
I know you
no
count,
risk.
and I also know you count your cells. We get you get good counts of your cells too, right?
Yes, we can count the cells. We cannot count specific stem cells, but we know from our general counts about how many stem cells we have in the mix.
That's amazing.
It really is a lot of fun. I got to tell you something. If I do a good facelift, nobody says anything about it. I do one knee, they don't shut up. They tell the whole world. Yeah. And really, the low-hanging fruit is the orthopedic stuff. It's real easy to fix. These neurodegenerative conditions are more difficult.
When you do those, like on, let's say on Parkinson's patients, do you give it in a certain place, the stem cells, or do you give it just intravenously?
Well, we started with intravenous because that's the easiest one, and we can get some information about that. Yeah. We're working with a top neurosurgeon in Southern California who came to us with this idea. This is Dr. Christopher Duma. He's one of the head guys down at Hoag Memorial. Yeah. He came with the idea of putting in an Ommaya reservoir, which is a little port that goes under the scalp, and it connects right into the ventricle of your brain where we make our cerebral spinal fluid. Right. And so we did some studies to show it was safe in rats, and then we are now doing studies in humans, and we're getting actually some pretty good results where we can inject these cells, and these people are getting the cells right into the brain through the cerebral spinal fluid and showing some improvement.
And these are like people who are, just explain what kind of injuries that...
Things like multiple sclerosis, Parkinson's. We're looking at Alzheimer's. We have anoxic brain injury. I just got an email today from a parent of a young man who had anoxic brain injury. He has a
there's no oxygen. Anoxic meaning like no oxygen.
Yes,
no oxygen.
I'm saying these words. I don't realize people don't know. He got stuck and literally with a little device around his neck, and he hung himself. He was choked, lost oxygen, but he didn't die. But now, because of that loss of oxygen, he has severe brain injury. And so now, by giving these cells back, he's starting to regain some of his
because you're going to be able to make some
of
those
speech and motion and things like that.
So, when you do all of these treatments for more serious procedures and things like that, I want to ask you several things. One is giving it IV, like let's say you're giving it, tell me some experience about like for heart or for brain. Do you have to go right like into the brain or into the heart versus let's say giving it into intravenously? Because I'm thinking, okay, the circulation time is not that much, and I know you've got a blood-brain barrier for the brain, right? So give me some idea about, is it better to do it like right into the organs, or can you like give it through the veins?
Yeah, well, these are excellent questions.
Yeah.
The key with this is delivery mechanism. So we're learning. For example, Johnson & Johnson's developing a microcannula to go right behind the retina for things like macular degeneration.
Where they can put the stem cells with the stem cells.
And in fact, we have an ophthalmology protocol right now where we're doing testing retrobulbar, which is behind the eye, and actually intravitreal injections. We had a guy who had complete blindness in his left eye from macular degeneration.
And that is so common. You know how common macular degeneration is.
Yes, and it was crazy, but we just tested a little intravitreal injection into the blind eye, and he started to develop sight, a few weeks later. Wow. So there's a lot of stuff we just don't know, and we're learning.
What is a plastic surgeon like you doing all this amazing stuff? What you're supposed to be just doing your cutting up and rejuvenation stuff.
The fun thing is,
tell me what is this?
The big criticism, why plastic surgery, playing a stem cell.
Yeah.
But you remember what I started out saying is we formed multi-specialty teams. So it turns out that your fat's loaded with stem cells, we do a little mini liposuction. I developed that technique. Yeah. And so really, you don't want a neurologist trying to do a liposuction.
Yeah, exactly.
You can have your specialists, like the orthopedic surgeons, come in the office, they'll inject the knees and joints.
So this is really cool.
But I'll just pull out the fat and produce the cells.
But if you pull out the fat, so not only do we all get skinny and we look good, but then we can use that fat, and you've got your team coming out, and then you can like get other stuff done.
Well, the scary part, this is why I want to work with you. We can get 2 for 1, because we were talking about this the other day. We're really looking at pro-aging. How do we prolong aging, not anti-age? I want to live for a long time, and with some of the things you're doing and with the idea of replacing your cells, potentially people could live well into their hundreds. Fundamentally, think about it. Why do you die? If you stay healthy your whole life, eventually you just run out of enough cells.
So can you bank? So let's talk about what the issues are about banking your stem cells. Because I know that's a controversial area. You can't really because you can't really right now in the U.S. really bank these stem cells, because then you're like taking them away. But give me some idea of what's going on with that.
We think we can do all the banking under the FDA standards and do it right.
Too. Exactly.
So we've set up a program. We developed another company called Cells on Ice. We're working with American CryoStem that's been establishing good banking protocols for a number of years. And basically the idea is we'll take a sample of your fat, send it to the lab, produce the SVF that has the stem cells, and bank it. And ultimately, we'll take those cells and expand it in the lab. What that means is grow your own stem cells in the lab.
It's your own, and it's your natural. You do understand that when there's like signaling growth factors, or you give insulin, it all starts from one cell. I mean, you eventually that cell has to come from somewhere. So you're doing the same thing with your own cells. You have your cells, and you are just growing them, and that's safe. That's absolutely safe to do.
Well, that's what we believe, and we have to do studies to, confirm the safety, and then show that it's effective, that it actually works. And we're pretty confident that it does. And if it's your own cells, it's not as big a problem as trying to get somebody's cells in a bottle. That will come out, by the way. There are companies all over the world trying to, process and grow and make stem cells that they can sell to us.
Why is it so controversial? Why do people have such a horrible idea about it? And I think the reason is a lot of times there's like stories told about how stem cells come from like fetal stem cells and stem like from babies, and stem cells come from all sorts of, and this is really, there's a term called autologous, which is like your own. And I think we need to really explain that to the public, is there's a difference between those two, right?
Well, we're in very early stages of this work, but we're using only your own cells because there's really no risk of me giving you a disease if I produce the cells in a very clean manner that I can guarantee is completely sterile. So that's absolutely safe. Now, the problem with the stem cell is that it's a huge industry. And the big pharmaceutical companies do not want doctors to help their patients until they tell us we're ready. which means they want to give me a $2,000 bottle of cells, or maybe a $20,000.
That's right, because they want to be able to, and
Exactly.
that's why they're going away from your own into maybe something that they can, get source out or grow in a laboratory and say, okay, this is the safe thing to give. What's more natural than giving your own self?
Well, we think it's pretty natural, and
Absolutely.
we're learning that it's very safe, and we're doing the work. And fundamentally, as doctors, what's our responsibility? To take care of our patients.
Absolutely.
So what a lot of the PhDs and the big pharmaceutical companies don't understand is we have a responsibility. And if we can take care of our patients, we don't have to wait till they get out of the lab.
Yeah.
So if we can do what we're doing under a surgical, sterile environment, then we can do it. The FDA, by the way, is responsible for two things: drugs and devices.
Right.
They police the drugs and devices. Everything that we use is...
But your own stem cells, your own stem cells are not a drug.
Well, the FDA may define it as a drug because
how do they do that?
Because the U.S. Congress mandated the FDA to prevent the transmission of disease. It started with organ transfers that were adulterated.
I understand that, but But then the transmission of disease can also start from one cell. But if you can figure out a way, it's your own cells that you're growing in your own environment, how is that going to transmit disease?
For example, it won't the way we do it, because we've got a sterile surgical procedure and it's closed. But if we produce it in the lab, say I take your cells and I take it to the laboratory, and I don't have a good sterile environment, and somebody comes in and infects your cells, then that
understandably, but
so
that's why you're standardizing it.
The FDA's job is to make sure that that's done in a regulated manner.
Well, then they should just develop a checklist. A checklist for, here's this checklist for, okay, you got a sterile environment, just like what they do in a hospital. You don't do surgery in some kind of like in your in the backyard. You do surgery in a hospital. So what's the big deal?
Well,
why not?
The FDA actually does that. So if somebody's producing cells in a laboratory environment, they can walk into your lab and they'll go through that checklist. And
well, then they should let you go. Then they should just say, okay, and then we need to get on with it.
No,
I want to know what's the issue with the FDA on this?
If you don't pass that checklist, then there's a risk of disease transmission,
but
and
if
they
you
shut
do pass,
you down.
that's fine.
That's what happened with cell techs. Remember Governor Perry in Texas? He got cells made somewhat similar to what we're doing, but they were made in a laboratory environment. The FDA shut them down. The cell techs came back, rebuilt their lab to conform to GMP, what they call good manufacturing practices, standards of the FDA, and now they'll be back in business if they're not already back in business.
So let me ask you this.
So
let's just say you do the checklist and everything. Then is there a future, in the very near future, we can bank our cells? That's what I'm getting at. I want to be able to bank. I want the audience and I want people out there to be able to know that they can go and just have their own stem cells. I think that's the best gift you can give your child right now.
This beats Obamacare hands down. This is the best insurance you can possibly have.
Exactly.
If you put your cells in the bank, you will have them in case you have a heart attack, a stroke, or an injury, a spinal cord injury. They're there and available right now. Then, secondarily, as we develop the protocols, you'll be able to expand the cells and hopefully get them back for anti-aging, so you keep getting them back.
This is a stem cell revolution here. Yeah, I know we're running out of time, but we need to really start. I love your website, stemcellrevolution.com.
Yes, thank you.
Yeah, we are in a revolution on stem cells. We want to be able to bank our stem cells, right?
We can bank our cells right now. And in the very near future, we'll be able to expand them and get them back with interest.
That's great.
Best bank you can have.
That's fabulous. Listen,
Best
I'm so glad you're here. Thank you so much for coming on the show.
Hey, Naina, thank you for having me.
Really, it's always wonderful to. And I've got another topic, by the way. So in a couple of months, okay? So
you call me when you need me.
I will. Thanks everyone for watching the show. This is NainaMD, Fusion of Science and Beauty. If you want any information, go to www.nainamd.com.